addressing the shortfall that was in front of us. I think you all did really good work in collaboration with our partners at OHA to really figure out how we could push up our sleeves and make an impending gap a little less. Since then, I know Carrie and I have both received questions from folks and some confusion about the money and how it is continuing to be rolled out with the burn grantees. So instead of taking this month to talk about our next steps, we promise that's going to happen next month in March, which is maybe for the best since we have a smaller group today. And take some time today. We have some updates from OHA and a request to slightly modify our opioid treatment program allocation. Folks will remember we were really specific there, so probably not a surprise that that we might have a reconsideration there. I'm surprised we haven't had more along the way. And then we're going to hear again from Abby Stamp and Ebony Clark from OHA about the burn funding and an update on how that's going. And then we want to take some time as a board to get your input on the letters that were requested at the last meeting. Carrie and I want to make sure that we're hitting the mark. The board had requested a letter to the local settlement board as well as to the legislature. So hopefully we'll have a little bit of time to take some feedback on that. And maybe even a little bit of time for some feedback overall on how that, how things went last month so we can roll into a very productive March meeting. So hopefully I've killed enough time with my introductions that we've had more folks join, and I think I am turning it over to Zach.
Thank you, Annalise. And yes, it looks like we are at quorum now, so thank you. All right, folks, if we can get the next slide, Kristen. We're going to start with roll call. So when you're here, when I call your name, please let me know if you're here. April? Adria?
Here.
John?
Here.
Tammy?
Here.
Annalise?
Here.
Zeb? Nick?
Here.
Lori?
Here.
Skylar? Joanne and Julia are going to join us at 10:30 today. Carrie had that conflict. Rick? Fernando?
I'm here.
And Sheriff Phillips. I believe it's.
Yeah, I'm here.
Thank you.
I thought my space bar would make my mute go away, but apparently it doesn't.
Yep. All good. Thanks for being here. And then I did just want to flag while we're on the screen that we do have a new non-voting member, Judge Celia Howes, representing the State Court Administrator. Does not look like she's in the meeting right now, but if she's at the March meeting, we'll do introductions then. All right, next slide, please. All right, so today's agenda, we're going to start with roll call. We already did that. We're going to review the meeting's objectives in the agenda, do our normal board business, have a brief discussion about what we would like to accomplish in the March meeting, just to make sure that we're on track as we're planning that. Go into our public comment period at 10:40. If you are a member of the public and would like to submit public comment, please message Sarah Rose by 10:35. We will then have our discussion of the OTP grant modification request, and then take a quick break before doing the burn funding update and adjourning the meeting. We have left the second part of the meeting for the burn update entirely, so we can use all of that time or just a part of that time, whatever folks need to feel comfortable moving forward. Next slide, please. All right, we will now do our call for conflicts. Just leave this up on the screen and give folks a chance to review. The only decision we have on the agenda today is that OTP grant modification. The burn conversation will just be a discussion, no decision. So I'll give folks a chance to review, and please raise your hand if you would like to declare a actual or potential conflict. All Right. Does anyone have anything to declare? Not seeing any hands. Okay. Next slide, please. Okay, now we can go ahead and get into the board business updates, starting with DOJ. Adria.
Good morning, everyone. Not too much on my front here, but the Purdue and Group of Eight settlements continue to progress. Very recently, all eight of the companies in the Group of Eight decided there's a period where they are given the choice to proceed or not proceed. They all chose to proceed. Good news, everything's going forward, and the Purdue bankruptcy and settlement continue to go forward. That's all I have on this front.
Thank you, Adria. Next slide. Tammy, fiscal update.
Good morning. Tammy Kelly. Just a reminder, I'm a fiscal analyst here in the Oregon Health Authority Public Health Division, and I work in the Injury and Violence Prevention Program. And this fund supports 0.5 of my FTE. So here to provide some updates for you. Apologize, I missed last month's meeting, but I have updated our tables and our slides here to be able to reflect the allocation that was made last month. So here, the payments received, we haven't received any additional payments. According to the payment schedule that I have on hand, our next payments are expected in March, so that is not unexpected. So our payment balance has stayed the same. And you'll see down at the bottom that the allocation on March 14th for the Behavioral Health Resource Network of $13 million is now reflected in this table. And so this brings down to the bottom our unallocated funds. We still have that segregated into two different groups. So we have the emerging issues carry forward from the previous biennium at 5.311 million. And then we have total available funds from expected payments in AY27. We have 5.256 million in that bucket. So that would bring our total available for allocation at this time to $10,567,887. Next slide, please. And then the other table that's been updated is our expenditures. So we have seen some additional expenditures come through, and again, added that allocation for the Behavioral Health Recovery Network here to be able to start tracking those expenses as the money is presented and expensed. Are there any questions on the fiscal front? Okay, well, I look forward to next month where there's going to be some planning. We can talk about emerging issues versus AY27, this biennium, available funds, and how that's going to be allocated and resourced out. And thank you for your time.
Thank you, Tammy. Next slide, please. Program updates from Courtney today.
Thanks, Zach. Good morning, everyone. Courtney Fultonier, she, her pronouns. I'm also with the Oregon Health Authority in the Injury and Violence Prevention Program, where I work closely with Tammy and then also Lisa Shields. Lisa is out for the next few months, no way, few weeks, recovering from knee surgery. She is doing well, and we wish her the best in her recovery. So I'm providing this update on her behalf this month. Just a reminder that we have our local opioid settlement learning collaborative meeting tomorrow, where Annalise will be providing a burn funding update, and Adria and I will be discussing the recent spending report from last fiscal year. We'll drop a link to the report in the comments for you all to take a look at. The report is still considered in draft form right now. It's going through OHA's final clearance process, but it is up online if you want to take a look. So if you're interested in hearing more about these topics, please feel free to join us tomorrow for the Learning Collaborative. Thank you.
Thank you, Courtney. We'll get that link in the chat in a moment. Next slide, please. Dana for the OTP expansion update.
Yes, hi Hi, good morning, friends. So things are moving along pretty good in regards to the OTP expansion. We have our Central Oregon Redmond agreement has been fully executed for a while now. The census still remains right around 90 individuals. The next location is our Clackamas site for Oregon City. That one is in progress. We have some, it's a new construction site being investigated. We just discussed with CODA this morning some budget. So we did some budget negotiation this morning, and that's looking really good. So looking forward to drafting up the agreement language to get that back over to CODA for some review and then get through the contract process. So we're about probably 4 months out on an execution for that site. The second Clackamas site, unfortunately, we still have not found a awardee for that location, and that's the location that we would like to discuss with you guys a little bit later on in the agenda. New season in Multnomah, both the Behavioral Health Investment Treatment Agreement and the ATRP agreement have been executed, and the construction is underway on that site. Everything is moving along according to schedule, so that's good news. In Northeast Oregon, that one is for ORTC. That one is also in progress, but it is still pretty slow going, searching for appropriate real estate options in that area of the state. So if you want to move to the next slide, unless there's questions. The second Eastern Oregon site, same situation as before, still searching for viable real estate in Eastern Oregon. Mid Gorge, that agreement is executed. They're currently in the recruitment phase of getting that workforce situated for that site. The Klamath County, that agreement is executed. Construction is completed. They're recruiting for workforce. We do have a slight barrier with our DEA. There's quite a delay in getting them down there to be on site to get that certification up and going. And I know our SOTA, Dr. John McElveen, is going to be reaching out, or has already reached out to our DEA partners to see if there's an anticipated timeline of when they can get down there, or kind of if there's any holdups that we don't know about. That would be great to know, but it's not on our end. ORTC is ready to go whenever the DEA is able to get down there. The coastal area, so coastal area number 1, our awardee is Acadia. The site location hopefully will be Tillamook, but we're also looking into Clackamas just to expand the possibility of finding a viable real estate in that area. We did draft up some contract language, and that has been over kind of at our Office of Contract and Procurement. They've been reviewing the language, and I think it's moving over to DOJ. So that's been kind of slow going, but it is in the process, and so hopefully we'll get something executed here soon. And I do see a hand up.
Hi, thanks. So this is in my county, and also Tillamook to the south of me. At some point, if Acadia doesn't perform, could that money be awarded to treatment providers who already provide services in Clatsop and Tillamook counties that already have an existing infrastructure and might be better return on the investment because they could go to work right away?
Well, I know that Acadia is working really hard on finding appropriate real estate. I know that they have a whole real estate team. They're actively looking for a site location. Part of the delay isn't on their part. It's sort of on OHA's part in getting a contract out to them so they have cash on hand in order to move quickly on if there is an available site. So we've already entered into a contractual agreement with them. It just hasn't been executed yet. And then in regards to possible looking at other SUD sites. Really, I think part of the motion had to do with that the awardees would be through existing OTPs. So I'm not sure if that's a viable option either, but John might have some additional clarification regarding that as well.
Yeah, thanks, Dana. Hi, Sheriff Phillips. Yeah, I'd love to discuss more. I think we just I just want to see what happens here with this. Our biggest, because there's already an OTP in Clatsop, as you know, in Seaside, and the part of the model for the expansion, and obviously we'd love lots of things have come up that have probably slowed us down more than we would like, but we are moving forward. One of the key things with that is when we did these allocations is to an existing provider to expand somewhere in the geographic proximity in which they operate. For example, like Acadia with Tillamook, they're already in Western Washington County. So there's some geographic proximity. But I think obviously, we can talk more about if things change. I do feel like Dana said that I'm pretty confident that they're going to get something done here soon. I know you're relatively new to the board, but we've had lots of discussions over the years about there's pretty severe siting laws in Oregon for OTPs, unfortunately, which has really, really been a challenge. We have some unique, just being very honest, like contracting structures currently in OHA in terms of this, which also just adds some layers of complexity onto it. But like Dana said, I do feel like we're making some progress, but that's part of these updates, right? To get everybody engaged and keep everybody in the loop and get thoughts. So definitely appreciate your thoughts and thinking about this and the importance of treatment expansion on the North Coast.
Fernando?
Yes, I mean, hey John, is this part of the lawn? This holdup, is this part of the compacted dork, or is this that plus other things or something else?
Well, yeah, this does sort of go back to the challenges originally that we talked about in Tillamook, where Acadia did have a really great viable property, and in that process of trying to kind of figure out the details, I'll say, or the small print, that's what we call it, right? The small print around what could and can't be done through our contracting process. That property was lost, unfortunately, and I know we talked to the board about that. To push things forward, because of the siting laws I was just mentioning to Sheriff Phillips and the severity of them in development of projects, I and Dana helping me with that work always try to do those address checks and make sure, because I want to make sure I can approve a program, and I don't want a provider to invest hundreds of thousands, if not more, because they're expensive to put up, and then end up not being able to do that without a county waiver. So to kind of help with that process, what we're trying to do is kind of structure contracts so that they have some flexibility. So when they see something, they can jump on it, and we can move more adeptly. So yeah, because until that law changes, it throws kind of a wrench into really covering all the bases planning wise, But yeah, that was originally that discussions around that did initially provide a barrier. You're exactly right, Fernando, in Tillamook County.
Okay, so the next coastal location is in Florence, and that agreement is in progress with Lane County. They have a building that they purchased that is within that 1,000-foot ORS waiver needed, possibly. John and I have kind of investigated a little bit further in regards to the Montessori schools licensure to see if it actually falls within the statute language. So we're seeking a little bit of DOJ advice in regards to whether or not it officially falls within needing a county waiver. But either way, we're really working towards community engagement with the school, making sure that they're aware of the OTP program and the type of services being rendered and how they operate, so that Lane County OTP is being good neighbors and is really making sure that the community is on board with that. So that's underway. That's an ongoing conversation that we're having. And I think John and I, we may also take some time to go down and perhaps go to a public community engagement meeting there to be available to answer questions. So that might happen as well in order to help move things along in that community. And the last area is also Lane County, and this one is in the eastern part of that county, and the awardee is ORTC, and they are looking to do a mobile that's in progress. They have located a company to do their mobile van, and they are currently developing their budget for me to consider and negotiate with them in regards to the cost associated with purchasing a van and operating a van. So that's making progress, and hopefully we'll have a more concrete timeline on when that will be operational. And I think, Zachary, that might be it.
Okay. Thank you, Dana. Any additional questions for Dana or John? All right. Thank you, Dana. Next slide, please. Just wanted to do a quick research, evaluation, and data subcommittee update. So the subcommittee is currently working through both parts of its portfolio. On the research and evaluation part, we're sort of grappling with the question of how to make the most efficient use of evaluation dollars, comparing what we want to evaluate to other efforts that are going on in the state and making sure we're not duplicating, and then still recognizing the importance of actually evaluating that board funded work. So that's a process. We're working through it, and we'll have updates to share with the full board soon. Steve Westberg and his team are drawing up a proposal for data system. So at our March meeting, we'll get a full proposal for what a data landing page might look like and how much that might cost. And then we can go from there, considering how much we have left in that data system bucket and if there's an opportunity to reallocate some of that to other funding priorities. So that's the red update. Are there any questions about that? Okay. We can move to the next slide, please. We are now going to do our public comment period. Sarah Rose, has anyone signed up for public comment today?
No requests.
Okay. In that case, we can skip forward to the next slide and the next slide. Okay. So this is going to be our miniature prep session for the March meeting. Just want to verify that our plan going to that meeting gives you all what you need to think about future decision making and how you want to allocate your remaining funds for this biennium. So our initial plan at the retreat was to sort of focus on the board priorities and what the current context is and how that might impact the funding framework. If the framework you all used last time is still relevant in the current situation, if it needs to be modified to address changing circumstances, questions like that. And then also thinking about the mechanisms that the board uses to get funding out, discussion of potential RFP processes, or how we can get more organizations involved in the process, and really provide clarity on how these organizations can request board funding and get before the board. So because of that, we have basically 2 or 3 guiding discussion questions for the March meeting. The first is, given the current context, what should the board priorities be for this biennium? The second is, how can the board be more accessible to more organizations providing services and research in the substance use disorder arena? And then finally, how can the board influence other decision-making bodies who can have an impact on substance use disorder funding? That last question gets to the regular conversations we've had about the local level of government, and then also how board members can use their moral authority, not just their funding authority, to advance this important work. Are there any additional questions that you all think we should consider when thinking about our funding framework for this biennium? Do those sort of hit the mark? Anything else that you would like to discuss in the March meeting?
Sorry.
Yep.
Yeah. You know, I'd like to say we have a lot of work ahead of us on this one because part of what we were trying to do and have been trying to do all along is to get some meaningful information about what services exist in different areas of the state. And so we're trying to build a system of care, not just fund a service in an area necessarily. And so largely when we created the original funding allocations, we were just like picking and divided sort of equally to make it work. And we're constantly trying to move to a more data informed system. And I don't feel that we have the data set. I don't know if anyone else feels this way or if anyone has something that I don't have, but I don't feel that we currently have the data set that we need to make the most informed decision. And so basically, we're just kind of going into this next meeting to start discussing these funding allocations, largely just picking and choosing again from what feels like what should happen. And I don't think that that's really the best way to do things. And so I would counsel, especially because we're getting to such a small amount of dollars right now that we can meaningfully allocate at this moment, that we try to move as methodically with as much data informed decisions that we can make. Because I feel like we're just kind of we're right back to where we were a couple of years ago. It was like we think we should put this much here, we think we should put that much there, we think we should put that much there. And it's just frankly, it's a little frustrating that this many years into it, we still don't have the information that we've been pretty much requesting for years at this point to be able to make more informed decisions.
Thank you, Fernando. Lori?
Thank you. I was about to ask for those questions. I don't know if anybody else is having this challenge. I can't copy paste from the chat. So if those could get emailed to us in the body of an email, I don't know if there's a function of the chat that doesn't allow that for protection of whatever, but that would be helpful. And then if you could also give us a deadline to allow some of us to give some thought to respond by, to add to this or ask for clarifications of this, that would be helpful. I'm thinking right here in the moment, but I'm also a percolator, so I'd like to know by when you would need that in order for it to be folded into the March meeting. And particularly for me, this last bullet, how can the board influence other decision-making bodies who can have impact? Knowing what those are, making sure we all know and understand what those are would be helpful, and what the various pressures on them might be would actually. So again, like Fernando said, we're sort of back to the start. And one of the things that was so useful that helped us do such a good job was some level setting, because we all come to this from a different perspective or a different understanding. So embedded within each of these bullets, there's maybe just some zoom out level set. So we're all working from the same assumptions would be really helpful. Thank you.
Thank you, Lori. Yes, we'll certainly email those out and put a deadline for feedback. Annalise?
So this is taking off my co-chair hat, Annalise Alcohol and Drug Policy Commission 100% hat. In response to both the comments so far, I mean, I think I would offer the ADPC as a resource. We have the comprehensive plan, which addresses strategies across the continuum of care, including infrastructure for the system. I'll pop our website in the chat. I've really been emphasizing to folks that that comprehensive plan, A, is for the state. It's not a report, it's a tool. So I would, offer that as a tool for the board to consider investments in where this fits into the system. We do have specific recommendations for where to invest settlement for dollars. I will also say we do have from 21-23, it doesn't include our spending, but we have a financial assessment of where the said spending in the state is and it is not. We will now be taking that in-house to do one for 23-25. That won't be ready for March, obviously. It'll be ready later this year. So I just want to offer that there is information out there to guide us. I understand that folks, want more information, and that's where we can invest our data dollars. But I do think there's information out there, and if there's specific questions, I'm happy to see where the ADPC can fill some of those holes.
Thank you, Annalise. Lori?
Thank you for that, Annalise. I wonder if in response to that, one of the questions is, what is our role as it does or could relate to the ADPC and its comprehensive plan? Because if we answer early on, like, oh, we're gonna try to align in ways that are compatible or support that plan, then then we have a structure. So I don't know if that's maybe a first pass question, both to avoid duplication of effort and also to potentially streamline or simplify how we make our decisions. And if that's not what we want to follow, we should have a discussion about why or what the gaps are, and the AEBC should know what that input is as well, I would think.
Thank you, Lori. Courtney?
Thanks, Zach. I was also going to offer, in addition to the financial analysis that Annalise referenced, we at OHA can prepare data in advance of the March meeting related to overdose rates, fatal and non-fatal. If that's also a data point that the board would like to consider, we can base that off of geography, demographics, et cetera. And so we'll work closely with the co-chairs to make sure that we have that data available for March as well.
Thank you, Courtney. Any other feedback or questions as we plan for March? All right. Well, after this meeting, we can go ahead and send around the current list of questions and then, yeah, provide an opportunity for folks to send any additional ideas that come their way in the next week or so that we can get those incorporated ahead of the March meeting. And then, yeah, we'll work with ADPC and OHA to get a meeting packet together that includes some of those resources so that y'all can review those ahead of time and have those inform your discussion in March. I will also point out we can be flexible during the March meeting as well. It's not like there's an intense deadline to finalize a framework in that meeting. So if it ends up being, more of a discussion and then moving into decision making later on, that is a possibility as well. All right, if there are no other questions, I think we can move to the next slide. And I'll turn it back to Dana and John for discussion of the OTP grant modification.
Yeah, beautiful. Thank you. So, as I've been reporting the last few months, is that we're struggling with finding an awardee for the Clackamas site for the number 2, the rural Clackamas County site. As we were, John and I were having discussions with viable potential OTPs, we had some conversations with Acadia CRC. And during that time, we did discuss a possible other location. But as a reminder, this is what the board motion passed back in July, and then it was amended in August. So we've been actively kind of seeking an awardee since 2024 with no movement really in that area. So the section that we're looking at possibly amending would be where the motion was 2 mobile or non-mobile medication unit in Clackamas County serving Oregon City and rural Clackamas County. So we do have an awardee for the Oregon City, so it's just the rural Clackamas. Everything else seems to be moving along just fine in the other areas at this time. So I think, Zach, is the next slide, does it show what the possible motion would be?
Yes, it
okay.
does.
So what we're asking is that the motion be amended to that one location in Clackamas County, and that we switch it to a rural community in Lynn County. And Lynn County is an area of the state that is in need, just like all Oregon is having opioid issues. And so this is a great viable location as well. And I don't know, John, if you want to add a little bit more details in regards to any complications that we have going on in Clackamas County, or any discussion in regards to why Lynn County is a good option to proceed kind of in.
Sure.
CRC did mention that they would be able to utilize the funds right away, which that would be a great bonus, right? Doing a mobile unit. So they'd be able to reach multiple locations in rural Lynn County. So that's, I think, is one of the main highlights as to why rural Lynn County, because it would just be as soon as we could get the money out the door, they'd be able to utilize it. So I'll turn it over to John to see if he has anything to add.
No, thanks, Dana. That was a great summary. I think just touching or highlighting on some of the things that Dana mentioned. We have had challenges with that second spot in Clackamas. I think a bright spot in Clackamas that I wanted to mention to the board, and I think it's a really good example, actually, of state and local collaboration, cooperation. We have CODA is committed to building a med unit in downtown Oregon City, or just north end of downtown, that's going to be integrated, I think, with some of the burn or other services that they have, crisis services, that are being built out in Clackamas. Additionally, CODA is also working on a medication unit in the Clackamas County Jail, which is going to be really an amazing step forward. So we're still sort of system building. I think, frankly, some of the pressure around adding that, what would really be a third unit, although just a second one funded through board settlement money, is I think folks have a lot of the existing really providers that really have that reach into the community, I think are stretched a little bit thin right now. So I think that's just the reality of it. But again, the silver lining is there's building out of capacity in Clackamas, which is a really good thing. And circling back to Lynn County, like Dana mentioned, it's an area of need. High overdose rates, especially in places like western and rural Lynn County, Lebanon, Sweet Home, that area, having a mobile accessibility to that close brick and mortar OTP in Albany, because that's where it would be sort of stationed out of, as the DEA would call it, is going to be a big benefit. And there's also, just quite frankly, just the pragmatic aspect of it. Dana and I would love nothing more than everything to get up and running, but we saw this opportunity in discussions, and instead of continuing to, as we do have some expansion taking place anyway in Clackamas, as we have this opportunity where Acadia has told us that they're going to be ready to roll really quickly, literally and figuratively, on the wheels. So I just thought it was a great opportunity to maybe shift a little bit, but still serve a rural community in Oregon that's in need, and still kind of fills that geographic gap that I always talk about being important with methadone. So.
Thank you, John. Open to questions or comments. Have Fernando.
Yeah, thank you. John, for everyone, please view these questions as informational. I think it's a good idea. I just want to get a little bit more clarity. Are they willing to, we had set up a few other kind of sort of requirements for getting some of this funding. Are they willing to do all that stuff, partnering with the jails and the pay, and they're saying they're ready to go right away? Does that mean that they're ready to launch the mobile unit immediately, or does that mean that they're going to start providing services while they build out the unit, the mobile unit? Some of those details would be good.
Yeah, no, they're great questions, Fernando, and obviously really, really pertinent. Our impression, and I could see if Dana has anything to say, is our impression is that they have a unit ready to go, and it basically what my impression, my strong impression, and Dana, please correct me if this is not accurate, is that they get an executed contract and they're ready to start. So that is great, and I love your question about collaboration, because we've talked about that, and we need to continue to talk about it in more detail as that contract gets finalized. methadone in Lynn County Jail. Not speaking, Sheriff Phillips is sheriff. I'm not speaking for the sheriff of Lynn County, but that's an organization that would be really fantastic to work with. And another great example of promulgating infrastructure really can make a difference. Is kind of like what you mentioned before, though, Fernando, is it's got to be targeted, and I think this still kind of fits into our target from really an evidence-based perspective, but also filling that geographic gap. So yes, collaboration and cooperation, I think, is going to be and I can't remember what language looks like, but Dana and I have been working on stuff, and especially Dana, who's been doing a lot of the heavy lifting in the contract language, is putting language in there that really kind of commits a provider that's going to take these funds to do that work with community partners, like correctional facilities and other important partners too.
Annalise?
So I don't know if this is okay, but I'm going to share something in the chat, and hopefully it goes through. It's a map. It is. I don't know if it'll get bigger for folks, but this is a map Lisa prepared for me to do a panel at a conference last fall. So I wanted to share it because I know when I heard this, I went back to the map to see, kind of where this would fit. And so basically one of the red stars in Clackamas would move down to Lynn, which you can see is a huge hole. So I'm really excited about this, and I'm just going to say for two main reasons. One is that it's a mobile unit. I think that is something that from the beginning we talked about the necessity in Oregon to bring some mobile units into the state in order to start to make these connections, and to reach people in more rural areas. And I know it's been kind of figuring out between John and Dana, you guys at the state and the feds, like what that looks like for the base and the security. So I think getting more mobile units out there is really important. I also just, want to emphasize we picked these sites based on data, overdose data, et cetera, but the money couldn't meet the need, and we knew that. So it's not like we're saying this means rural Clackamas doesn't need it. We're just saying this is a place we can put it, and it is just startup money. I'll remind everybody of that. And part of the reason for that is that these are services that once they get up and running are sustainable. They don't need more money for the state. They don't rely on cannabis funding. They don't need to come back to us through their claims. It's actually a sustainable service. And I think in these tough budget times where we can stand up services and then say, hey, you got this, it's a really good use of our money. So I'm very much in support of this.
Thank you, Annalise. Any other question, Lori?
Yeah, I was able to double click on the map and enlarge and save it, but there's no legend. But I'm assuming is blue established, red in progress. Obviously, the mobile is the mobile. Look, the stars, the blocks, the red, the blue. Can you provide that? Because this is great. I love this, but I don't know entirely what it means.
Yeah, I put it in the chat, and if I was smarter, I would probably do a screenshot of the whole slide, and I'm happy to send this to people afterwards, and John and Dana can correct any updates that have been made.
Oh, that's great. That it literally is like Annalise kind of described it. Like if you take a little blue bus that's hovering somewhere around the Multnomah Clackamas County line, and you just put it down over like Sweet Home, that's where the new bus will be. So.
And these are just represented by things that the settlement funds have supported, or because that's what I'm asking too.
It's all opioid treatment programs.
All opioid treatment in the state. So there's no way to differentiate which of these have received support from settlement funds versus other streams.
I think the red stars and the red bus are the new settlement funded OTP sites.
Yes. Exactly.
Does that include local dollars, or would this just be the state investments? Okay, so red is opioid settlement funded, blue is existing.
You got it. Exactly. Exactly. And so I think, yeah, so I think our red, I think we'd really be looking at the red bus moving to Lynn. That's right. Yes. Because we have four existing mobile units in the tri-county metropolitan area, in Washington, primarily Washington, Multnomah. And I think to Annalisa's point about expansion and the value, and it's a great point. And also just to circle back to the subject of Clackamas County, I don't, we want to continue to support Clackamas County. There's a lot of good stuff going on there, and local settlement dollars are going into some of that opioid treatment expansion, especially in corrections that I talked about. So it's sort of, we'd love to, as Annalise put it very well, which I won't put it as eloquently as she did. We're not, Clackamas is developing, and I think we have to continue to look at ways, and I do in my other role as SOTA, continue to look at ways to cooperate and collaborate with Clackamas County on building out more stuff. But I'm really excited, especially that kind of example of like local settlement funds funding the Clackamas County Sheriff to build one in the jail, and then we're going to have one down the hill in Oregon City. It's just a great, operated by the same OTP provider. So there's a sort of a seamless, like Fernando said, it's a little bit like that. It's system sort of building, and there's geography goes into that, a variety of access to a variety of services that are needed that go well beyond opioid treatment. So I think it's just a great example of that. So.
Thank you, John. Any other questions or comments on this potential motion? Okay. We did have a couple folks join midway through that discussion, so welcome Julia and Joanne. Just wanted to provide a brief synopsis of this draft motion, and Dana, please correct me if I get anything wrong. But basically the purpose is to have one of the mobile or non-mobile medication units in Clackamas County move to a rural Lynn County mobile unit. There is a provider ready to go, so it's just transferring that funding. Is that correct, Dana? My rapid summary?
Yep, you did good.
Okay,
Yep.
great. Julia or Joanne, do you have any questions about that, or any clarity that we can provide?
No, this is Joanne. I read the discussion in the meeting materials, so I feel pretty comfortable knowing what that's about. So thank you, though.
Of course, thank you, Joanne.
Yes, and same. Thank you.
Great, thank you so much. Okay, if there is no further discussion, we could have someone put forward this motion. There's a volunteer.
I'm happy to make the motion. I move that the Opioid Settlement Prevention Treatment and Recovery Board amend the motion passed August 7th, 2024 as follows. With respect to the 3.9 million to fund mobile and non-mobile medication units, I move to fund only one, not two, mobile or non-mobile medication units in Clackamas County serving Oregon City, and instead fund one additional mobile or non-mobile medication unit serving rural Lynn County.
Thank you, Annalise. Do we have a second?
I will second.
I think Adria got in first.
Sorry, Fernando.
I was trying to get in and read the draft motion because we know how well I do those. So
Next time, we'll save it for you. All right, Kristen, if we can go to the next slide for the roll call. First, any further discussion before we go into the actual vote? Okay. When I call your name, let me know if you vote yes, no, or if you abstain. April?
Aye.
Adria?
Aye.
John?
Aye.
Tammy,
Aye.
Annalise,
Aye.
Zeb,
Yes.
Nick,
Yes.
Lori.
Yes.
Thank you. Skylar. I don't know if Skylar joined us. Joanne,
Yes.
Julia,
Yes.
and I don't think Carrie has joined us. Rick. Is Rick in? No. Fernando
Yes.
and Sheriff Phillips.
Yes.
All right. That motion passes. Thank you, everyone. We can now move to well, okay, we are running rapidly ahead of time. So great job being efficient, everyone. One thing that we could do, so our burn presenters will be here at 11:40. So that will be our start time for that module. In the meantime, though, in the packet, there are two letters, one to the legislature and one to local decision makers regarding the burn funding allocation and requesting action on those items. What I would propose is that we take a few minutes for y'all to review those letters if you've not gotten the chance to already, and then we can come back and have a discussion about if those meet the mark, if there's anything else you would like to include, or if that messaging's generally on track with what you're expecting. Does that sound okay to everyone? Seeing head nods? Okay. I'll drop the packet link in the chat again, just in case, and then let you know which page it's on as well. All right, the link to the packet's in the chat now, and the letters start after the OTP letter. So they're the ones marked draft, starting on page 5. There's 2 letters there. First one's legislators, second one's to locals. So if we want to just take 5 minutes or so off camera, if you haven't gotten the chance to read those, take a look, think of any questions or modifications that you would propose, and we can come back and have a discussion about those. So if we come back at around, say, 11:05. Okay, folks, thank you. All right, folks, it is 11:05. If we could come back together. Welcome back. Hope you all enjoyed your reading break. All right. If you are back but not on camera, could you just give me a thumbs up so I know you're here before we get started? Okay. Okay, I think we have most people back. Okay. Annalise?
So I can kick us off. Since as your co-chair, I'm gonna start us with a little apology and mea culpa. I can't speak for Carrie, although I think she's probably in the same place. So you will see that these letters are draft, and huge thank you to OHA for drafting these. I know I did not review these before they went in. So I will say that there's a couple things that for me I'm not comfortable with, in particular in the first letter asking the legislature for more funding for just the burn program. I'd love to hear some more about intent from everyone else in the group. I think our intent in the past with the legislature has been, we would really like to work with you to find long-term sustainable funding for our system, but not advocating for one particular program, which in this budget environment would mean the exclusion of others. So I'll just kick us off with that comment. I think these are, draft. I don't want people to think that like this has been, that Carrie and I spent a ton of, but again, thanks for folks for getting us started.
Thanks, Annalise. Sheriff Phillips?
I had real similar comments. I think that the legislature does not have a pot of gold of never ending money to fund all the requests. And I think that if we want long-term sustainable funding, we need to accept that, not keep asking the legislature to overextend themselves. I think that long-term, we need to look at how to stabilize the revenue, the marijuana tax revenue, and to not spend more than the average of it over a period of time, so that we don't end up with these. I don't even know if we can honestly call it a surprise, but because they weren't meeting the revenue projections for 18 months, but here we are. And on the second letter, I just want to note that I know that my county has not spent much of the settlement dollars yet, because they're saving up to start a program, and once we have enough in the bank, then we'll be able to do it. But other counties might be different, or in cities, and so this might be, a fine ask.
Thank you, Sheriff Phillips. Any additional initial thoughts?
Jump in. I think I have really similar thoughts, and sorry for not raising my hand. I jumped right in front of you, Commissioner Schrager, and didn't realize. But I would love to see the letter kind of directing towards sustainable funding for the behavioral health system in general. We just had rather than just the burn funding. I think that looking at ways to ensure that we can sustainably support all of the services, particularly when we just completed a cost study, or OHA did, related to what community mental health programs are providing and the significant gap in funding. I think that there's just so many different areas where investment and sustainable funding is needed, and targeting just here, I would, despite the need, I would feel a little bit uncomfortable with that. And I think so. I just agree with the statements about the first letter. Related to the second one, being a county where we have actually a board resolution and order around where the funds are being directed, and a number of cities are directing funds toward our services and projects as well. I know that there's just conversation about some of the local jurisdictions. The funding that they're getting is relatively small, and it's a difficult task to even lift up how to fund that. And so I guess with an ask, I would also love to, if there was resources as far as how a city or a county that isn't investing funds already would be able to invest in the burn. A lot of these folks just don't have the ability to manage contracts and different things with different entities. And I guess with the ask, it would be sort of like a how-to as well, and just an acknowledgement that not every jurisdiction that's receiving funds would be able to make that direction, and the ones that could would probably need a little bit of help doing it.
Thank you, Nick. Lori?
Thank you. And thank you, Annalise, for starting us off with that caveat, because my first question is, and forgive me if this board directed or requested these letters be drafted, is what is the purpose? Because for both of the letters, this board lobbying to direct funds to one piece I don't know where that came from. And so I'm trying to understand what even is the purpose. If what we want to do as a board, as we did talk a little bit about, and I'm hoping we could talk more about this in March, is I love the phrase that was used about using our moral authority, I think it was, that Zach said. If part of our purpose and our strength is to provide a unified voice to continue to elevate the needs of the people being served by these funds and how inadequate they are, and how if we don't make significant investments, we're never going to really build the system that we know needs building, that is a very different letter than what either of these looks like. So from this board up to the ledge, it's more of that conversation that we had a bit when we were around the table in Salem of like, why are these services, why does it stigma? Everybody shies away from having the hard conversations and putting the ledge in a position of having to discuss what really are the priorities for where money is going and what's the efficacy of those allocations. And to the locals as a county, appreciate Matt's comments. We also at Lane County, we've nibbled around the edges of some allocations to backfill some critical services, but we are really trying to protect and preserve those to support a sustainable, systemic gap that we're going to fill with a stabilization center. And it feels, if I wasn't on this board and I received that letter as a local, I feel like the first I'm hearing from this board is y'all telling me what to do with these. It doesn't feel good. It doesn't feel good. And not all burns, just like not all locals are the same, not all burns are the same. They're doing phenomenal work, but they're not all doing work necessarily. Not all the investments are being made in things that are, the best practice or evidence-based. I mean, this is messy. I don't understand where these letters came from. I guess I could have just asked that question and left it at that before going on. But that's where I'm at in this first round of the conversation.
Thank you, Lori. Yeah, and I'll just say at the end of the retreat conversation, there was a desire for the board to get basically explain its funding decision and see if there was an opportunity to get other jurisdictions or officials to join in on funding some of these programs. So it was not like necessarily a formal ask per se, but it came up in that conversation. So just took the initiative and wanted to provide something for y'all to react to, which is what we're doing today. But thank you for all of your feedback. Adria?
Yeah, and I think maybe some of this comes from something I brought up at the end of the retreat, which is that there is in the interstate agreement about settlement funds a requirement to spend or encumber funds within 5 years or 7 years if it's a capital expenditure. So we are approaching, I believe, 4 years this summer, and there are multiple subdivisions who have not spent or encumbered funds from those initial payments, which are which do represent a substantial amount of the funds distributed so far. So that's probably where some of this is coming from. And the cure for that within the state settlement agreement is for subdivisions to remit those received funds to the board. So think uh, I think maybe there is a point to be made that using funds that are up against the time limit to burns within their community, in their local jurisdictions might there might be an argument to be made that it would preserve funds within the local versus being sent to us for our allocation. But I think there's maybe some more careful language to be smithed around that, so that it sounds like an opportunity versus a demand.
Thank you, Adria. Fernando?
Yeah, I guess my comments aren't that different from everyone else's, but the frame I'd like to put on maybe the letter could be a little bit different, which is I think in this moment we're running at a shortfall and doesn't have any money. So to come and ask our legislative partners for more money at a time where there isn't none doesn't actually do anything other than just add problems to their list of problems. So I think this is the moment to offer solutions in the form of the long-term strategic vision that we've been championing, to really point back to how this group is working closely with the ADPC and how, to Nick's point about long-term sustainable funding, um, is actually the way out of this, not tactical lobbying, launching money at problems, but more trying to, this moment where the money is short is really the time to start looking at a long-term strategic vision and how to maybe invest in that. I do think it's worth it to highlight in the letter that the shortfall is there. I mean, but everyone knows that already. But I definitely think that now is the time for that moral voice to be like, hey, we're going to keep finding ourselves in this spot unless we have a long-term sustainable funding mechanism. We have this strategic plan that we spent a lot of time building out that's looking towards a system, not just now, but in 20 years from now. We really want to affirm that that's where we think this should go. We understand that the system is going to have some shortfalls for a couple of years, but continuing to try to cover gaps without thinking of the future, we're just going to end up always covering gaps. So I do think a letter's good, but directly asking for cash right now will get us exactly just put at the bottom of the list of other things that also need funding.
Thank you, Fernando.
Can I make it?
Yep,
Can I make
absolutely.
a comment? I can't figure out on my iPad how to raise my hand, so I'm sorry about that. Going back, I think to some of the previous comments about that the sheriff made, as well as I think Adria's concerns. I looked at this and thought, if the cities end up getting this, because they don't necessarily have burns in their communities, they may be at the county level. They probably won't even know what this is about. And I was concerned about that. I think if a message came from Clackamas County to the cities that said, if your money's going to go away and you have to turn it back in, you could send it to us and we'll use it for these purposes. But I just thought, I'm not sure that they really would understand what this means and what it's about. So that's my concern.
Thank you, Joanne. Others? Annalise, and then Zeb.
So I'll throw out a question to the group. I mean, I'm hearing the strong message that we need to take a beat on these. I think these were thrown out at the end of us being together for 5 hours after a very long day, and we didn't really dig into exactly what we wanted to say. A question about the message to the local subdivisions. So we have time tomorrow at our monthly local subdivision collaborative to just report out and say, just so folks know, I believe Abby Stamp from the Measure 110 program is going to be there to answer questions from locals. And then I was going to offer to folks, just so you know, this gap is coming. This is what the state settlement board did, and this is why we did it. So the question is like, is that the right message from the board? And is there anything else, like, do we want to, that you would like me to say on behalf of the board? Especially getting to some folks' questions about like, making sure they have the information for what their local burns are, that they have the access to the website and things like that. So that's my question. I should have let you go first, Deb. I'm sorry.
No, thank you, Annalise. And I apologize for not being on camera. I'm not sure what it is about this particular link, but I can't access my camera on it. But then I'll hop on the Measure 110 meet and I'll have my camera. But anyway, um, so I have a potential conflict of interest. I'm a chairperson on the Measure 110, but I also am a clinical director of SUD disorder clinic that receives Measure 110 funds. So I try to get clarification from the Ethics Commission just on how much I could talk on this, but I'm keep getting a voicemail. So I'm going to err on the side of caution. But what I will say is no matter what, it's greatly appreciated, I think, for the state of Oregon and for us trying to brainstorm solutions to these shortfalls. And it's really, um, you know, um, nice to see that given that there's shortfalls and the marijuana tax revenues are continuing to decline, that we, as as this body and other bodies, are looking for ways to meet the needs of our state. So thank you guys very much.
Thank you, Zeb. Just want to open up for discussion on Annalise's question, since that learning collaborative is tomorrow. Is there specific things beyond the letter that, which is obviously, going to take a longer time to redraft, specific things that you would like Annalise to mention in that collaborative tomorrow?
And I should say Adria will be there as well. And I think Courtney presenting on the annual. So, I mean, I think Adria, you will probably make that point as well about the time is ticking.
It might be helpful to also know from them how much they know about this, about even, do you know whether you have a burn, where the services within your community are, and just to get a sense of how we would tailor a letter to them to help clarify or ask for their action.
Lori?
Thanks. Yeah, I have it on my calendar, and finally have it on my calendar and don't have a conflict. So I'm really hopeful I'm going to be able to be on that meeting tomorrow. I don't know who's been present historically. I'm even sending a letter and an email here internally from staff side. I don't know who's been there from Lane County. I don't know what the conversations, what the flavor's been. So I'll be very interested to learn that. But I do, to the point that was just made, more of an inquiry of how can we better integrate our efforts? Again, not lobbying for a particular path, which is burns. Whose problem are we trying to solve? We're trying to solve the problem of an under-resourced system, or are we trying to solve a state funding problem around a system they set up with an unstable fund to put burns in place? That will drive a very different conversation. And that these letters drive that conversation. And I'm not sure that's the conversation that we should be having. It's certainly not the conversation or the questions that recipients of these funds are trying to answer with their funds, however large or small the pot may be. So I think I kind of lost my train of thought, but I think you get where I'm going. So yeah.
Thank you, Lori. And I will just great that you can attend tomorrow. Folks are invited to attend. So if you would like information on that meeting, you can email Courtney, I believe, and we can get that information to you. Adria?
Yeah, thanks for that, Lori. Like we said, I will be at that meeting tomorrow as well, and I'm there every month. I would say in general, just for flavor purposes, I think we have about 40 to 50 regular participants from around the state, both the city and county level, but I think it maybe tracks towards the more engaged subdivisions. So the ones who really aren't having a hard time spending their money, they are, really being very, very proactive and they have plans in place. So perhaps it will be a bit of preaching to the choir, which is always the problem with a voluntary group of people. Uh, what was the other thing I was going to say? Oh, as someone who is not intimately involved with the workings of Burns and was kind of and didn't really know a lot about them, and I bet it would be very helpful to have this sort of an explainer about Burns and just what services will that they are currently receiving within their communities that will go away because of this shortfall. Services that someone is going to have to step in and provide regardless of why the shortfall exists. Um, so that would be something I would love to hear, and I'm sure, especially maybe at the city levels, um, would be very useful to hear. And then another question that came, so when I provided a report to my office after the retreat, one of the big questions that I got up the chain was, hey, what happened to these funds? Like, what do you mean there's $100 million shortfall? Why? Where exactly did that shortfall come from? And I think that a thorough explanation of how and why, how those numbers were arrived at and why they are no longer accurate would be helpful to provide context um, to the subdivisions as well.
Thank you, Adria. Courtney just dropped in the chat that you can email her if you would like an invite to tomorrow's meeting. So I know they always appreciate when board members attend, so that is open invite for any of those meetings. Any other comments on the collaborative meeting tomorrow or the letters? And Courtney just dropped the join link for the meeting tomorrow in the chat as well, so you can save that if you would like to attend directly. Okay, I have a summary slide tracking your feedback on the letter that I just want to share real quick and make sure we captured everything so that when we go into the rewrite process, we have everything in mind. Let me get to it. Okay. So this is some of what we heard, and is it showing up for people? Not yet?
Not yet. Not yet, Zach.
Now?
Yeah.
Now we see it.
Okay, love Zoom. Okay. Here is just some of what we heard in the conversation. First of all, there needs to be a takeaway about the specificity about the burn program and add language about stable funding for SUD programs overall. Stable funding for behavioral health funding in general, reference the needs study that was just completed. For local jurisdiction, add information about resources and how to direct funding to burn or other sources. How do we encourage the legislature to have these hard conversations about sustainable funding? More careful language around this being an opportunity and not a demand, particularly to the local levels. Offer solution in terms of long-term strategic vision we have been championing. Highlight in the letter that this shortfall exists. This is a time for a moral voice. We're going to keep finding ourselves in this spot unless we do invest in a long-term vision. If the subdivision gets this, they may not even know what the letter is about. Maybe if the letters to cities came from the counties. If your money is going to go away, you can use it for X. And then more information generally on why the burn shortfall occurred. Are there additional things that people would like us to consider as we redraft the letters? Lori?
Yeah, just I don't think the letter to cities should come from counties.
Okay.
Leave it at that.
Thank you for flagging that. Sheriff Phillips?
I just feel like there is a stable funding for the burns with the marijuana tax. It might not be as much as we hoped it was, and it might fluctuate a little bit. But if it was managed appropriately, we could have a level funding for a long time. And so sometimes instead of just asking for more money from the legislature, I think maybe it would be helpful if they held people accountable. Uh, like who made the projections that were completely wrong, and then decided to go ahead and award money that didn't exist. Long term, that's the solution I feel we need. I know that wouldn't be a very popular letter. I also feel like we never got, or I don't know that I truly know who asked to write these letters in this fashion. And I feel like to some degree that this board is being used to for our influence to pass someone else's message along.
Thanks for raising that. I will say we're bringing these to the board for that feedback, so it's not our intention to draft letters without getting your feedback. So that's why we're here today. As mentioned, it came up towards the end of the very long meeting about just wanting to use this opportunity of the burn funding decision to reach out to the legislature and local government levels. And then we talked further about this in our meetings with the co-chairs as well about drafting some sort of letter. So definitely not going to send out anything until y'all approve it and make sure it's in line with what you're looking for. Are there any other comments on the letter?
Zach, I
Yep.
just want to clarify. I think when I was making that reference to if the letter came from the counties, they could understand it. I wasn't advocating that the letter would come from the counties. I'm just saying that local jurisdictions would better understand what that was if it was coming from their county, but I'm not advocating for that. So I think maybe if we take that out of what the feedback portion is, I would feel better about that.
Okay. Thanks for that clarification. Yeah, and I think once we redraft the letters, maybe at our next meeting, there'll be a conversation about best way to distribute as well.
Thanks, Joanne, for that. And I would just say what I recall, and I am absolutely willing to say this recollection is fuzzy, but what I recall from our conversation in Salem was we agreed that we had with our save the day, frankly, moment that we had with the Save Lives Oregon allocation previously, and then with what we did in Salem with the burn funding, we felt that gave us a position to talk about how much we're doing to do our part as a board to fund the problem across the state. And it was an education opportunity and we are being good partners. Here's what we're doing. And so that message is timely all the time. And particularly to the legislature, I don't know that it's certainly not during or necessarily even on the immediate, but it is on the close heels of session. But it's also all the time. So that was what I heard us talk about was this sense of like we are approached as if we haven't decided what to do with the money, so somebody else might need it and have an idea. And we want to start educating folks about what we're doing with these funds and how we arrived at those decisions and what we still see as the opportunities and the need and how we want to start working with the state and the locals to build the system that we know we need. That's the sort of the nut of what I heard us wanting to express. I'm not sure how that, if I'm recollecting that, I see Fernando nodding anyway, translated into these letters.
Thank you for that clarification, Lori. Do other folks generally feel that that's the direction they would like the letters to take? Seeing a few head nods, thumbs up. Okay. Yes, well, we'll clearly go back to the drawing board with these and make sure to present revised letters to you all at the next meeting. April?
Thanks, Zach. And I just really appreciate the conversation and everyone sharing some of my concerns as well. So I didn't have to jump in. But I think there are some internal process concerns as well that just haven't been named. To share Philip's point around who we're representing and the decision-making piece feels a little bit murky to me as well. So I would want to take a moment I would just propose that we hold off on the letters. We talk about what messaging, like Commissioner Trieger was suggesting, what messaging it is that we want to share and to who, like who our audience is. I think internally there's also a conversation needed with OHA around whether they're comfortable with this board representing this as a need and direction from on their behalf. And I think that there's a process internally between the agencies and the governor's office that needs to confirm how we want representation of agencies' requests to come at the legislature and or other jurisdictions. And I share some of the concerns that were already shared around if we are requesting money here, are we also asking for what we could be losing unintentionally if they shift funds from other places? It's much too big of a question to put out towards local jurisdictions and to the legislature at this time. So I think that I would like to propose that we hold off on drafting letters, and that we discuss what it is the messaging that we want to share and to what audience for the board's recent decisions beyond the press release that we've sent out.
Thank you, April. Seeing some head nods and hearts on that. I think this fits in nicely with that conversation we wanted to have about moral authority, not just funding authority at the March meeting. So maybe if we hold off on letters, talk more generally about our overall approach to that question. A letter may emerge from that, it may not, but that might be a natural spot to talk about this. Does that sound like a good idea to folks? Seeing some head nods. Okay. Excellent. Well, we are coming up on a short break, and then we'll get into our burn presentation. I did just want to note before we go to our break, though, that our new non-voting board member has joined the meeting. That's Judge Howes, so welcome. I don't know if you would like to introduce yourself at all. Sorry to put you on the spot.
Okay, yeah, thank you for having me. I'm Celia Howes. I'm in Multnomah County Circuit Court. I run our DUI intensive supervision program here in Multnomah County, so have some work that I do that relates to our system partnerships with treatment providers in the community, and with a real focus on substance use disorders and funding streams that relate to treatment and rehabilitation, and kind of like directing dollars toward that out of the prison system, and the idea that that improves public safety outcomes. I think that's sort of the experience that I'm drawing on and participating as our OJD non-voting member here as part of this group, but I am also just here to sort of be a sponge and absorb and learn about the work that you all are doing. And if there's any input or questions you have of me, I'm happy to answer questions. But I imagine these first few meetings will be functioning mostly as an observer until I kind of get the hang of things and can be a more meaningful participant. So thanks for having me.
Thank you. Welcome. We look forward to working with you.
Me as well.
All right, folks. We can go ahead and take a 10-minute break now and then come back for the burn presentation and discussion. So it's 11:39 right now. Let's just come back at 11:50, get an extra minute, and then we'll get into that discussion. Thank you all. Welcome back, everyone. We could come back together. All right. Welcome back. Kristen, if we can go to the next slide, please. Or Jenny, who's ever doing the slides now? There we go. Okay, so next we have our burn funding update discussion. I just wanted to turn it over to Annalise, I believe, to introduce, and then we can get started with the presentation and Q&A. Or not.
Sorry, Zach. Zach is doing such a good job that I forgot that I was needed. I mean, I think I prepped earlier for the members that weren't here in the beginning. We decided today, instead of moving on to our forward-looking discussion, which I promised we're going to do next month, to hear an update from OHA about the burn funding and the effect of the amount that we have allocated. So we kind of all understand the numbers. I know after the last meeting, I heard, Carrie and I both heard from several board members, there was just a lot of confusion about what was the cut going to be, what was the effect of the settlement board funding. So we thought it would be best to have Abby and Ebony come and give you guys an update and answer all the questions so that we're all certain of what this means, and then we can move forward next month. So welcome to our OHA friends. We are very happy to be collaborating with you on this.
Great, thank you. Hello again, I'm Abby Stamp, and I joined OHA about 18 months ago. I'm the executive director of the Burn program, and I will get us through a few slides here. I first wanted to start out because when I joined you all last month in Salem, I know you were having your retreat, and I just wanted to get to the content quickly, and I just didn't have a real chance to introduce myself and tell you the perspective I bring to this work. As I said, I've been with OHA for about 18 months. I previously worked at Multnomah County for 20 years. And, you know, civil service is not civil service. And going from a county perspective into working for the state, it's not the state of Oregon government system is not just a big county. It is absolutely a different world, right? It is massive and complex. And so part of that is when we respond to big, complex asks quickly, we want to make sure that we're responsive, that there are errors made, we will correct them as quickly as possible. So I just really wanted to appreciate the conversation that we had last month, and thank you for the opportunity for having us back. And I've prepared just a few slides to answer the questions that your co-chairs presented previously. So moving on, the first slide is going to be for Janelle Evans, who's from OHA Budget, to walk through a simple chart about the impact of your contributions to the burn program. Janelle?
Hi, good morning. Can you hear me okay? Great. Good morning. I'm Janelle Evans. I'm OHA's Budget Director. I've been with the Health Authority since 2002. So a good long time. Thank you for this opportunity to share more details on the overall OHA budget for our burn partners. On this slide, we are looking at our 25-27 biennium. And I want to note that these numbers are based on the December revenue forecast because we have a new revenue forecast that just came out this morning. The first column shows the numbers. The first column of numbers is what our budget looked like without the addition of $13 million from the opioid settlement fund. And the second column shows the impacts those funds have. So the first line there shows the first year contracts are going to be a total of $98 million for the burns. And the second fiscal year will be about $27 million less for a total of $71 million. And the additional funding, we were able to basically reduce the reduction from 14 to 14 million. So the payout will be about 84 million. our projected total available funds changes from 214 million to 227 million for the biennium. And this also allows for us to have a contingency fund of about 17 million. I want to note that the forecast that came out this morning reduces the fund by another, I believe it's $3 million, between $2 and $3 million. So that contingency is already going to drop from 17 to 14. Because we won't have to reduce because of the contingency, we won't have to reduce the amount in the contracts.
The second question that was brought is what's the impact to the providers? And what does the 14% shortfall mean? In short, we don't know yet, but we will very soon. And that's because my team is working on a process through which we can hear from providers what the impact means in terms of FTE, services, clients served, and just the general impact to as the budget adjustment to their overall budget. And so my team is working right now one-on-one with all of their grantees, having one-on-one meetings to assess that. We will have a lot more information soon. And of course, hoping that grantees will be able to stick with us and not have to shutter their programs and be able to maintain as many services as possible. Next slide. So I apologize. I had updated this slide. We've been using the term negotiations for redoing budgets, and really it's not a negotiations. It's adjusting the scope of work to a reduced budget amount. And so how will this adjustment be conducted with grantees? On January 17th, after the correction was made to the 14%, my program sent out a communication to all 234 grantees. We have a budget template, which is a tool folks can use to build their own budget based on current tools that they have been using to report their expenditures with written instructions. We've been using a smart sheet scope of work survey so people can report back to us in all 6 of their service areas. These are the FTE we're going to reduce. These are the slots we're going to reduce. These are the milestones we're going to reduce and really give us the information we need to assess the impact of these reductions over the next year. We also made a technical assistance video walking people through the Smart Sheet survey, one field at a time, to help usher folks through the use of that technical support. And then we also created a slide deck so folks could read the instructions, they can listen to the instructions, they can watch the instructions. And we put all of this information on our Burn Resources webpage to have that available for folks to support them. And in terms of the process, we want grantees to tell us how they want to work with the restricted budget amount. Do they need to lower their milestones? Do they need to drop a service area, with the hopes of getting that information back by February 11th? Because then my team needs to really look at it and get a sense of what's the global impact, both across the state and one county at a time. And pursuant to Governor Kotek's Executive Order 2601, grantees are asked to prioritize and preserve as much housing and 24/7 services as possible. So my team will assess the impact to all of our legislatively required programmatic components, such as we need to have service areas, all 6 service areas covered in each county. So we need to receive that feedback and take a close look and look at how the landscape looks for burn services over the next year. And then the latter months this spring, we'll be finalizing grant agreement amendments, creating new budgets, new milestones, and getting through that process. And before I move on to the last slide, I want to tell a quick story about how this was working in the spring when the Oversight and Accountability Council made its first votes and allocations of drug treatment recovery services funds back in March. We found out that nobody in Tillamook County wanted to do screenings and assessments, and screenings and assessments are a required part of every single behavioral health resource network. And because our value is that providers tell us what they can and can't do with the dollars, it is OHA's responsibility to start reaching out and figure out how to serve those gaps. and fill those gaps rather. So I called every single grantee and asked their executive directors if they had any wiggle room, if we could give them some extra funds that the OAC allocated to cover those screenings and assessments, and everybody said no. And so then I reached out to previous grantees who had decided not to participate again to see if that was something they would be able to take on. And one provider said yes, they could take that on. So we created an additional grant agreement with that organization to fulfill that legislative requirement. And so that I wanted to share with you to really demonstrate the balance of being provider driven and sensitive to what providers can and can't serve because they know their organizations and their capacity best with the legislative requirements that remain in our governing Oregon revised statutes. And then the last slide, please, is what else is OHA doing to help fulfill this funding gap or minimize impacts of the shortfall? I think Janelle said it beautifully, where we just got a new cannabis tax revenue forecasting, it yet again declined. And because there's a policy decision to create a contingency fund, we'll be able to minimize future disruptions on this based on the fluctuating cannabis tax revenue. We also internally as a team applied for a block grant opportunity through SUPTers, through the Substance Use Prevention Treatment Recovery Services, to mitigate lost revenue. Whenever we also get other grant opportunities passing through our inboxes, we forward that to our grantees as well. Lastly, I'll let Ebony chime in a little bit more on this last point, but OHA has been conducting agency-wide prioritization process to assess initiatives and different funding streams and deciding how to either maximize or scale back in response to federal policy and all of our fiscal and budget constraints. So those were the 5 questions that your co-chairs brought and wanted to make sure I answered those. I want to hand the mic over to Ebony for any comments.
Yeah, no, thank you, Abby. Ebony Clark, Behavioral Health Director, pronouns she, hers. And again, just want to reiterate that what we recognize is hard is trying to sustain programming on a revenue source that, is not constant. And it's been our priority, and we're committed to trying to look at how we can be strategic, intentional, thoughtful, and trying to find a way to make sure that we are able to sustain these resources, but also again trying to look at a way that allows us also to not take a cookie cutter approach, but an approach that allows folks to say, hey, based on our burn, based on our region, this is what we're proposing with what we're having to navigate. As Abby has said, we on the OHA side have also done, we'll continue to do our due diligence in terms of also just looking under every rock, every stone, every couch cushion of, are there funds that we can look at trying to fill the gap, because it's going to take a multifaceted or a diversified approach to sustain funding. And so again trying to look at what are the opportunities with the block grant, understanding that there's a lot of shifts and changes at the executive level, but again we wanted to prioritize the continuum of care and the behavioral health resource network. So we will fully know the outcome probably next week around just the level of impact or where we were able to leverage a portion or percentage of block grant. And then just in terms of the strategic prioritization effort, I think what I'll say there is that across the agency and within the division, we also are having to look at how do we reconcile the funding that we have specific to state general funds to the revenue and to the forecast. And so we're having to be thoughtful and intentional of how are we, number one, making sure that everything that we are moving forward in terms of a policy decision, behavioral health priorities, that then result in funding really get at the current needs that we see across the state. Not, and obviously, one of those core priorities does center around how do we continue to address, not only the opiate overdose crisis, but what I also like to call the polysubstance crisis too. And so we do know how critical the burn funding and the burns are in working to support individuals and stepping into and maintaining a path of recovery. So we're still walking through kind of our prioritization exercise and efforts as an agency, and it's been somewhat kind of phased. And I'd say that we're kind of in maybe phase 2.5, and part of what we have the responsibility to do is to make sure we're doing our due diligence to say that all the resource we have and all the capacity that we have focuses on key targeted priorities. We're not continuing to move forward funding programs that just aren't resulting in the outcomes that we're looking for. And again, that, as I said earlier, what we do fund, what we do contract, what we do focus on, what we do prioritize truly meets present day needs. So this is going to be an iterative effort and process while we continue to look at, opportunities for potential additional funding and not losing sight of how we support the burns. And the last thing I'll say is that, we, definitely will continue to be in conversation with our legislative policymakers, appreciate the governor's office and Amy Baker and, all of her support. And, we're doing our due diligence to make sure that others that also play a role in helping us explore and prioritize funding have a clear picture just so that we can make an informed decision. So thank you.
Thank you, Ebony. And I would just like to close with some gratitude. We're doing absolutely everything we can and the best we can to support the Behavioral Health Resource Network providers within the statutory limitations. And that means dealing with this really volatile revenue stream. And so I just wanted to say thank you. Thank you for allowing me into your retreat last month. And thank you for your generous contribution. It was really heartening to be able to, sounds terrible, but to tell people that your budget reduction is only 14%, which is awful, but instead of 27%. So again, thank you for that. And I just wanted to make sure I close with a moment of gratitude.
And the only other thing I'm going to say, and then open it up to questions for y'all, is that, for those that know me, you're going to be like, here Ebony goes. But again, I've been at OHA for 3 years, and, part of the premise that, I committed to in my role is really making sure that we're being transparent, we're being responsive, that we're doing our parts around accountability and integrity, and really being able to demonstrate our efforts that really, again, sustain, uphold, and best position our behavioral health continuum of care. And so, again, I appreciate you all and your questions, and quite frankly, you're, holding us accountable and not being afraid to ask hard questions. And so I just want to thank you for that.
Thank you, Abby, Janelle, and Ebony. So we have the rest of the time reserved for Q&A and discussion. So that leaves us with about 50 minutes. So I'll just open it up first for clarifying questions for Abby and team.
Can I ask a question?
Absolutely.
Oh, could you folks once again clarify what the contingency fund will be utilized for? it seems in the whole scheme of things and the shortfall that it's a pretty small number to have some kind of impact over the biennium. So could you just explain again how that 17 million is anticipated to be used? Thank you.
Janelle, do you want to answer that?
Yeah, I can take that. So the purpose is twofold. Mostly we're concerned with the volatility of the revenue. And so we want to be able to absorb basically the revenue decreases as they come. As you know, since we got our budget in July, the September revenue forecast dropped 6 million, December another 6, and the one we just got here today was between 2 and 3. So I'm hoping that their forecasting is getting better and closer, and we won't continue to see such large drops. And so we're hoping that contingency fund basically allows us to stay within budget, and any of those funds that aren't used this biennium will just roll to the next and help us with the next biennium. So none of the funds are going to be diverted away from the burns, but just its timing of when the money will go out to make sure that we can sustain and have cash flow.
Sorry, just to jump in because I can't figure out where my hand is in this Zoom thing. Janelle, can you, just for folks who don't know about forecasting, can you explain who does the forecasting as it relates to the marijuana revenue tax?
Right. It's not done by the Oregon Health Authority. It is done by the Department of Economic Analysis. They provide a statewide general fund and several of the other state funds updates every quarter of the biennium. So they're projecting the revenues and the forecast.
Annalise?
So just to clarify, since we're going down this revenue path, Janelle, I know you mentioned earlier, I know that the revenue forecast that was released today is another $3 million cut, but it sounded like you were implying that would all come to OHA, but that's actually spread out amongst all the marijuana revenue recipients,
Yeah,
right?
I think the total was 3.4. I think, sorry, it just came out. I think it is the total that we get. It's 3.4 is the OHA part.
So you're saying that the entire, when there's a cut, that because there's the marijuana revenue goes to multiple sources. So it would be absorbed across everyone. I think I'm a little confused by that, but maybe that's a conversation for another day.
Yeah, sorry, late breaking news, and I want to make sure we get it right. But I believe the number my staff gave me was just the part that it's already divided apart, the part that goes to OHA for the burns.
So it's a 3.4 million total, of which 2 to 3 goes to the burns through OHA.
We'll confirm that for you. The exact amount.
Thanks, Janelle. We can make sure to send a follow-up email with that information. Other clarifying questions or reactions?
I guess a reaction is just I left the meeting down in Salem just with a different impression of what the gap and the shortfall was. I think that our conversation was really focused on a 14%, and I know that when I discussed our investment, it was really to try to fill in a gap of 14% to level off the projected 7% that we were going to be seeing in the second biennium that was a part of this funding cycle. And so I guess part of me is just trying to understand where I misunderstood that, just because all of the presentation was really around a 14% that I think we saw and heard that number over and over again. And so I thought that that was really what we were looking at in advance of the investment that was made. And I guess given the revenue forecast that we just received, is the anticipation that we still rebound to that 7% that we were looking at for the last two funding cycles of this contract period, because I think that that's going to be important to know, just as burn providers are getting this notification right now and they're working on budgets and impacts of this funding reduction. Is, do we anticipate that actually goes back? How is OHA managing that contingency if it does come back and we can reinvest that into the system? Because it just seems to me like now is the time to spend that and invest rather than taking this hit right now, which is going to be pretty difficult, I think, for our burn providers to recover if we anticipate the funding revenue is going to go back up.
Janelle,
not
I
sure
think
if I
that,
should.
yeah, that's definitely, thank you for helping with that.
Okay, well, I wasn't here for the last meeting, but let me see if I can maybe help. Where maybe it might be confusing because the 14% cut is for the last year of the biennium. Overall, the revenue decrease it is more like 7.5 or 7%. So for the 2-year span. So that might be where some of the confusion is about what the percentage is or was. I just want to say that the contingency we're building in here allows us to deal with the fluctuations of the revenue because it does seem to be trending down. Like I said, another 2 to 3 million this morning. And because of that, we aren't going to change the numbers basically that you saw. The contracting amount for the second year doesn't have to go down. We don't have to try to pivot again and reduce what we're planning to spend. So we'd like them to plan with what we think we can get them, allowing for these small revenue changes. If they go up, we can have another conversation, of course. And like I said, anything that isn't spent this biennium does roll to the next biennium to also deal with potential revenue shortfalls or just for spending out. So it's not going to go unused. It's just trying to be responsible with and being able to commit to a number that we can have enough revenue behind.
Abby?
Oh, thank you, Janelle. And I'll add that this is why we will be doing this budget look and potential reset every 12 months. So the scope of work survey I mentioned is something we will be doing annually with the grantees so that we can make sure that we're both working within the dollars available and using the contingency wisely, all with the goal of mitigating negative impacts fiscally to all of the providers and grantees and ensuring that we can keep the funding as stable as possible. So I'm glad we have created tools that we can use regularly. And as the biennia shift and as the funding forecasts continue to come in, we know we have a contingency, some savings, right, to help offset any volatility in the future. And we've been really thankful for the budget partnership to help us figure out what a reasonable contingency might be. But knowing that none of us are economists or have our finger on the pulse of the cannabis market and have a sense of where it will be in 2028.
There are additional questions or reactions? Did anything particularly stand out in the presentation that you would like to discuss? Not seeing any hands. So just a reminder, we have the rest of the meeting time reserved for this. So if folks don't have questions or don't want discussion, we don't have to, but this is your time. So if there are comments that you would like to make or questions, this is your opportunity. Zeb?
I'd just like to say thank you to Abby and Ebony for coming here today. And thank you for all the work that you guys do. Really appreciate it.
Fernando?
Yeah, I guess this is sort of a meta comment or a meta answer to your question about questions and comments. I don't know that there's really many questions or too many comments to make, only because the reality is we're looking for money, and we're like we shook the couch, we checked the couch cushions, we checked everywhere. There is no more resources. So I think just the reality that we're all facing is very real. It's in the room. We all feel it. We all know it. We're just trying to navigate as much as we can. And in line with Zeb's comment, and I said this to Abby when we met last month, thank you. Thank you for everything that you've done to try to bring some stability. Ebony, the same. Thank you. Your leadership has been felt over there over the past 3 years. We're just trying to make the best of it in a bad situation. And so I don't really, for me personally, I think part of the reason there's not much discussion is because we have no way to produce more revenue. We have no way to predict what the cannabis market's going to be. So we are all just kind of left waiting at this moment, and trying to come up with hopefully some strategic solutions that can help avoid similar situations as much as possible. These things happen. Budgets, money comes, revenue goes up, revenue goes down, but we can hopefully through some strategy and through some long-term planning have the swings be less impactful when they come. So, but yeah, mainly thank you, Abby. Thank you, Ebony. Thank you for your transparency. But honestly, just thank you for the work that you do, putting it on the line every day. It's really appreciated.
Thank you. And thank you, Zeb. That means a lot. Thank you.
Thank you, Zeb and Fernando. Any other final questions or comments? All right. I am seeing none. Are people generally comfortable adjourning early at this point, or is there anything else folks would like to discuss? Seeing head nods for early adjournment. All right, folks, I think we can go ahead and call the meeting then. Thank you so much, Abby, Ebony, and Janelle for your presentation and answering those questions. We have a couple email follow-ups to send about the March meeting and the discussion questions there that will give you an opportunity to provide some feedback, and then some resources for that retreat as well, or for the meeting that replaces the retreat that we will include in the meeting packet for March. Other than that, we look forward to seeing you at that meeting. Please feel free to reach out to us in the meantime if there are any questions. Thank you all.
Thank you.